Drinking a warm cup of joe as you awake is traditional among most people. And let's discuss those hidden benefits that you may not have been aware of in this common man's drink. Moderate coffee intake, about 2 to 5 cups a day, is linked to a lower likelihood of type 2 diabetes, heart disease, liver and endometrial cancers, Parkinson's disease and depression. Every day, about 90% of Americans consume caffeine in some form. More than half of the adults in the country consume 300 milligrams a day, making it America's most popular drug. For reference, a 12-ounce can of a caffeinated soft drink typically contains 30 to 40 milligrams of caffeine. An 8-ounce cup of green or black tea contains 30 to 50 milligrams, and an 8-ounce cup of coffee closer to 80 to 100 milligrams. If you eat or drink too much caffeine, it can cause health problems such as restlessness and shakiness, insomnia, headaches, dizziness, fast heart rate, dehydration, anxiety. Too much of a good thing is bad for you, the proverb applies. Did you know that there are 8 ways to make your coffee super healthy? No caffeine after 2 p.m. Do not load coffee with sugar. Choose a quality brand, preferably organic. Avoid drinking too much. Add some cinnamon to your coffee. Avoid low-fat and artificial creamers, and add some cocoa to your coffee. Caffeine in coffee is a psychoactive substance that changes the chemicals in your brain. And after drinking caffeine, more specifically coffee, daily for a while, your body becomes reliant on this chemical change to function and as such becomes an addiction. While caffeine has been linked to improving people's problem-solving skills, it can also be addictive because regular use can cause physical dependence. Still, it is nowhere near as detrimental as addictive drugs. Some studies show that caffeine intake is linked to weight loss, reduced body mass index or BMI, and fat mass. Caffeine intake may thus lower the risk of conditions linked to overweight or obesity, such as type 2 diabetes or cardiovascular disease. Coffee drinkers around the world are rejoicing. A new study shows that a moderate intake of coffee may lower the risk of premature death from certain illnesses. Mayo Clinic nutrition expert Dr. Donald Hensrud says that the healthy benefits of drinking coffee are pretty good overall. Coffee is beneficial for those having type 2 diabetes. Consume coffee is linked to lower risk of type 2 diabetes. The relationship is well established, says a new study, but the mechanism remains unclear. The study in clinical nutrition suggests that Drinking coffee could lower the risk of type 2 diabetes by reducing subclinical inflammation. The benefit was strongest in drinkers of ground coffee, filtered or espresso, and people who do not smoke or who never have. How coffee influences inflammation. Lead author Dr. Carolina Ochoa Rosales, a postdoctoral scientist in nutrition and genetic epidemiology at Erasmus University Medical Center Rotterdam in the Netherlands, told Medical News Today that type 2 diabetes is partly considered an inflammatory disease, and it is accepted that higher concentrations of pro-inflammatory markers in plasma constitute a risk factor for type 2 diabetes. The study found that drinking coffee boosts anti-inflammatory adipokine hormone, adiponectin, levels and cytokine interleukin 13 or IL-13. At the same time, coffee consumption decreases levels of C-reactive protein or CRP and leptin, which promote inflammation. Why inflammation matters in diabetes? In people with type 2 diabetes, insulin produced by the pancreas cannot control blood sugar levels. Such insulin resistance allows these levels to rise dangerously out of control. Insulin resistance is largely determined by subclinical inflammation, and coffee seems to improve by reducing this inflammation. In short, insulin resistance is an inflammatory condition, and coffee seems to help subside this inflammation. Adipokine secreted by adipocytes makes patients more sensitive to insulin in addition to having anti-inflammatory effects, according to Dr. Cowsell, an endocrinologist. Coffee makes your immune system stronger. Coffee is known for its energy-boosting caffeine effect. It's an abundant source of nutrients and helpful chemicals to aid your immune system. Coffee protects against autoimmune disease compatibly within the acquired immune system. The caffeine content within coffee potentially suppresses the proliferation of Th1 and Th2 cells. As a result, coffee can reduce the damage caused by the release of cytokines due to overactive T and B cells. Th1 type cytokines tend to produce pro-inflammatory responses responsible for killing intracellular parasites and perpetuating autoimmune responses. Interferon gamma is the main Th1 cytokine. Th1 cells mainly develop following infections by intracellular bacteria and some viruses, whereas Th2 cells predominate in response to infestations by gastrointestinal nematodes. So, coffee can reduce the damage caused by the release of cytokines, thus boosting the immune system. Now let's discuss coffee and liver health. Coffee also lowers the risk of other liver conditions including fibrosis, scar tissue that builds up within the liver, and cirrhosis. Drinking coffee can slow the progression of liver disease in some patients. Beneficial effects have been found when the coffee is prepared, filtered, instant, and espresso. Coffee has antioxidant properties. Coffee, one of the most consumed beverages in the world, is composed of many substances and polyphenols that make coffee a functional food thanks to its beneficial activities. Among the main polyphenols in coffee, chlorogenic acid and ferulic acid have shown promising antioxidant properties. 2 to 3 cups of coffee daily linked to longevity, lower risk of cardiovascular disease. Good news for coffee drinkers emerged earlier this year, with studies reporting that drinking coffee is linked to a lower risk of mortality and that moderate daily coffee drinking may reduce kidney injury risk by 23%. However, historically, more than 75% of medical professionals had advised patients with cardiovascular disease to avoid coffee. Recent observational studies challenge this misconception by discussing caffeine consumption safety and beneficial effects concerning arrhythmias and cardiovascular disease. More information was needed on the impact of different types of coffee on heart health. This prompted researchers at the Baker Heart and Diabetic Research Institute in Melbourne, Australia, to conduct a large observational study that would provide some insights into the role of caffeine on cardiovascular outcomes by comparing the impact of decaffeinated and caffeinated coffee. The newly published findings indicate that instant, ground, and decaffeinated coffee, particularly at 2 to 3 cups a day, is linked to a lower risk of cardiovascular disease and death, and caffeinated coffee significantly reduces the risk of arrhythmias. So viewers, I have discussed the beneficial health effects of drinking 2 to 3 cups of coffee daily. Hope this video article was helpful. Until we meet again, goodbye for now. Thank you.